Okay.
Has to be read, like you could read it.
Okay.
1,
Mm-hmm.
2.
Okay. Go.
Imagine your 6-year-old daughter is in her room playing with her Barbie dolls happily. You go to the kitchen to make dinner, and when you come back, she's sitting there hopeless, looking at the wall, and she tells you that she no longer wants to live. You bring her with you as you finish making dinner, and by the end of the night, she's running through the house, thinking she's Superwoman, and thinking that she actually has to go and save somebody's life. What I'm explaining to you is something that can happen in the daily life of a child with pediatric onset bipolar disorder. 1 million children are currently diagnosed with pediatric bipolar disorder in the United States. One of those children is my daughter. What I'm going to explain to you today are the symptoms of pediatric onset bipolar disorder, attention deficit disorder, and how it compares to pediatric onset bipolar disorder, and the challenges in the life of a child with pediatric onset bipolar disorder. First of all, symptoms of pediatric onset bipolar disorder include hypermania and mania, depression, anxiety, and anger. These are the 4 cycles that a child may experience rapidly throughout the day as they cycle through bipolar disorder. An adult with bipolar disorder will cycle through these maybe four times in a year, where a child with pediatric onset bipolar disorder will cycle through these rapidly throughout the day. Other symptoms of pediatric onset bipolar disorder include over-aggressiveness, being very bossy, and being very risk-taking. A few of the shocking side effects of pediatric onset bipolar disorder include hypersexuality, where a child at a very young age is interested in sexual things that is way too young for their age. And one of the other shocking side effects of pediatric onset bipolar disorder is children who have actually thought of suicide. Children as young as 6 years old have actually attempted to commit suicide. Moving along, I will explain to you attention deficit hyperactivity disorder and how it relates to pediatric onset bipolar disorder. When you compare the two, it's easy to see how attention deficit hyperactivity disorder can sometimes be mistaken for pediatric onset bipolar disorder. In fact, almost about 80% of children who have been diagnosed with pediatric onset bipolar disorder have been previously diagnosed with attention deficit hyperactivity disorder. The 3 main symptoms of attention deficit hyperactivity disorder are inattentiveness, hyperactivity, and impulsiveness. All of these are present in a child with pediatric onset bipolar disorder. However, the difference is a child with attention deficit hyperactivity disorder has these symptoms basically all the time until they're medicated. They do not go away. A child with pediatric onset bipolar disorder can go through periods of their life where none of the symptoms are present in the cycling of the bipolar disorder. In addition to this, attention deficit hyperactivity disorder has been studied medically since 1902. So, and pediatric bipolar disorder has only been studied pretty heavily in the last 10 years. It's been mildly studied in the last 20 years, but more in the last 10 years. So not very much is really known about pediatric onset bipolar disorder. It's easy to see how pediatric bipolar disorder can be misdiagnosed for attention deficit hyperactivity disorder. The last thing I'll be discussing with you are the challenges that parents and child face once a child has been diagnosed with pediatric onset bipolar disorder. The first thing, if a child decides to medicate their child, is to prescribe the child with a mood stabilizer. Many mood stabilizers have pretty serious side effects. Side effects may include skin rashes, liver and kidney disease, troubles with the heart, and trouble breathing. If these symptoms are not closely monitored, they could lead to death. Many times, if the actual mood stabilizer does its job as mood stabilizing, other additional medications will have to be prescribed in order to combat the side effects of the mood stabilizers. So the child could end up being on like 10 different medications because so many medications counteract each other. Now, once a mood stabilizer is prescribed to a child, it is sometimes necessary to prescribe the child with an antidepressant. If the antidepressant is not prescribed properly, the child can then again become manic, which completely starts over the cycle of prescribing the child medication. Once a child is prescribed medication, they have to be slowly put onto the medication. If the medication does not work, they have to be slowly taken off of it. Therefore, the process of properly prescribing a child with medication could take anywhere from 6 to 18 months, and that is the average of what it usually does take. All right, in conclusion, we have discussed the symptoms of pediatric onset bipolar disorder. We have discussed how attention deficit hyperactivity disorder compares to pediatric onset bipolar disorder, and we have discussed some of the challenges of pediatric onset bipolar disorder. I would like to say that I believe every person who works in the medical field, who works in law enforcement, who is a teacher, who has any job that deals with children, should be educated on mental illnesses that affect children. It is not always a lack of discipline that makes a child act out. Sometimes the child really is sick. We should not give up hope that these children should someday go on to live normal lives.